I'm Maggie Meltretter, and I'm the nurse that's taking care of Mr. Eric Foreman. Today I'm going to be answering some of the questions that his family members have asked me. The first question is, what caused the heart attack? Mr. Foreman's heart attack was caused by a blockage in his heart. The heart has a bunch of little rivers, I guess you could call them, that are arteries, and that's how blood gets around the heart. And when you have a heart attack, there's a blockage in one of those arteries. So usually these blockages are caused by plaque buildup, and it creates like a dam so that the blood can't get past. This causes the pain, and then also the rest of the heart that's past the blockage cannot get oxygen. And so that's what caused the heart attack. The second question is, will he recover? Yes, he absolutely should recover because we have removed the blockage with a cardiac catheter procedure, which is where the doctor goes in and finds the blockage, the little plaque buildup, and takes it out. And he also placed a stent, which is basically like a straw, like a drinking straw, that the doctor put in the artery to make sure it stays open and doesn't collapse or get blocked again. The third question is it going to happen again, and can it be prevented? This is a big issue because yes, it could happen again, and yes, it can be prevented. There are things that Mr. Foreman can do to make sure it doesn't happen again, and those things are mostly lifestyle changes. So he needs to eat a heart-healthy diet because the plaque is caused by high cholesterol, which Mr. Foreman has high cholesterol. And so eating foods that are high in cholesterol in his diet are going to increase the amount of cholesterol in his body and cause another buildup potentially of that plaque. So foods that are good for a heart-healthy diet are foods that are low in salt, low in cholesterol, and low in fat. So that means things like lean meats or grilled fish instead of fried chicken or steak. Also means eating a lot of vegetables and staying away from really fatty fried foods that are salty, like French fries. Another thing that Mr. Foreman can do is to keep his diabetes well managed, and actually eating a heart-healthy diet should help him do that. But he also needs to make sure that he takes his metformin as he's supposed to and monitors his insulin, or his glucose, along with other medications he takes amlodipine and losartan. One of those is for high cholesterol and one is for high blood pressure. Mr. Foreman really needs to make sure that he takes those medications as directed by his doctor every day, because high blood pressure and high cholesterol can also lead to heart attacks. The last thing that Mr. Foreman can do to help prevent a future heart attack is to stop smoking cigarettes and drinking alcohol. We know that those are two things that can also contribute to heart attacks. So hopefully if Mr. Foreman can follow these educative steps that we want him to take, he should recover well and not have another heart attack.